Lie on the floor with your knees bent, have your feet wider than your mat, and gently allow the knees to move together to the right and left hand side. You can move slowly, moving with awareness. Allow your breath to be natural. If it feels comfortable, you can allow the legs to rest to one side of the body whilst breathing deeply into the side of the waist. Nice deep breaths. And then switching to the other side, allowing the knees to comfortably rest towards the side of the body. Remembering to breathe down into the waist, nice deep slow breaths. Remember, this should not be painful. If it is at any point, then just stop. The movement can be kept smaller. You don't have to go to the end range for your legs. Bring the knees back together and bring your right knee towards your chest. The left leg can stay bent. Again, breathing down into the side of the rib cage and into the tummy. We want to hold each of these movements for about 5 breaths, and then rotate the leg, bringing the ankle onto the opposite thigh and gently moving the knee backwards and forwards. Again, it shouldn't be painful. The hand is there to guide the bent leg, not to force the leg. We want to do about 5 repetitions before straightening the leg up towards the ceiling. Making sure that you're getting the back of the leg straight. The leg doesn't have to be perpendicular to the floor. It could be at an angle. What we want is to have the leg straight, and then take the straight leg down towards the floor. As the heel touches the floor, bend the leg and bring the knee in towards the body, and then straighten the leg again. We want to do that in both directions, about 5 repetitions. So once you've worked 5 times in one direction, then raise the straight leg up towards the ceiling, bend the knee, bring that in towards the chest, and then slide the heel along the floor before raising the leg back up towards the ceiling. Remember to practice with awareness, really focusing on keeping your breath slow and steady. Remembering that if you are experiencing pain and discomfort, to modify the movement in order to reduce any painful sensations that you might be feeling. And then we need to repeat that on the other side. So starting by bringing the knee in towards the chest, nice deep breaths. Gently encouraging the leg towards the chest. You can have the hands on top of the shin or even behind the knee. And then bring the ankle onto the thigh, allowing the knee to move backwards and forwards. About 5 repetitions, again working to a range of movement that actually feels comfortable for you, and then taking the straight leg up towards the ceiling. Again, the leg doesn't have to be straight, it could be at an angle. Putting the toes towards you and then lowering the straight leg down towards the floor, bending the knee, sliding the heel towards the buttock, and then straightening the leg again. So it's a cycling movement, 5 times in one direction and then 5 times in the other direction, working with awareness. So when you change direction, the straight leg goes up from the floor towards the ceiling, you're bending the knee, and then stretching the leg along the floor by sliding the heel along your mat. Awareness of what's happening with your lower back. We want this movement to be coming from the hip, so we want some stability in the lower back. And then hug your knees towards your chest. We can do some sideways movements with the feet, so keeping the knees and ankles together. Allow the feet to move together to one side and then to the other. So we're side bending the back towards the side of the feet. Coming to lie now on your side. You can have the bottom arm underneath your head and bring your other hand onto your waist. Keeping the legs together at a 90-degree angle. We're going to start moving the hips. So start with the knees together and the foot coming up, and then feet together and knee coming up. It's really important here that the movement is coming from the hip. The tendency is to rotate the back. So with the hand that's around the waist, just bring some awareness as to whether you are rotating your back and maybe rolling backwards a little bit as you do this movement. We want to create some stability in the spine so that we're focusing the movement in the hip. You can then progress this by resting the hand on underneath the head and bringing some side bending into the side of the body. Again, bring your hand onto the tummy, make sure that you have some stability within your spine, and we're creating compression on the side of the body as we're lifting the foot up towards the ceiling, and then gently lowering back down. And we need to do this on both sides. When you change position, just make sure that you are really aware of the position of your back. Bring your knees to 90 degrees, check in with your lower back. Really feel that the back is stable, that you're limiting the rotation by creating a little bit of core engagement. And then the movement comes from the hips. So knees together, foot comes up, feet together, knee comes up. Head is relaxed on the outstretched arm. We want to do about 5 repetitions on each side in each position. And if you want to make this a little bit more challenging, again, we can raise the upper body. If you struggle to keep the back stable, then keep the head resting on the floor, or if your neck is sore. So the head can rest in the hand. Bring those fingers into the fleshy part of the waist. We want to feel that those muscles are working and that the back is stable. So we're limiting any movement in the spine and really focusing that tension that we're creating into the leg which is raised, or the foot that is raised. You can bring the hand underneath the ear to increase that stretch a bit more, but remember that the weight of the head is completely supported by the hand. And then coming up to a seated position, have the feet wide, the knees bent, and allow the knees to go from one side to the other. This is very much imitating the movement that we did previously when we're lying on our back. The movement can be quick and small, or it can be slow and big, depending on what works. And then bring yourself into an asymmetrical position with your legs, one leg bent behind, the other bent in front. Our focus is on the hip of the leg which is bent behind. So we want to squeeze the glutes as we thrust through the hip of the leg which is bent behind, and then we want to sit the sitting bone of that leg down towards the floor. Then bringing the hands on the floor in front of you. If this is too difficult, you can place the hands onto the thighs and just allow the head to relax. Our aim is to keep the sitting bones in as much contact with the floor as possible. This can be quite challenging. You could add a little bit of pressure from the hands in order to keep the centre of gravity back through the pelvis before switching to the other side. So again, the focus is on the hip of the leg that is bent behind you. So change the leg position, and then you're thrusting through just that groin area by squeezing the glutes at the back of the bent leg that's behind you, and then sitting the sitting bones back down, and then coming into a forward bend, the hands being placed wherever is comfortable, and allow the weight of the head to encourage that very passive forward bend. Remember, this shouldn't be painful. When you're ready, coming onto all fours, tucking the toes under if that's comfortable for you, and we're going to come into just some gentle cat-cow movement. So breathing in, looking forward, shoulder blades sliding down, breathing out, rounding the back. Remember that the movement should be slow with the breath, and you can do a little bit of wiggling around, trying to find any areas of tension, moving the hips from side to side, and doing whatever feels comfortable before sitting your bottom back towards the floor, knees nice and wide, and allowing the body to come forwards. You could rest your chest on a cushion or a bolster and finish with some nice, slow, deep breath, just allowing the back of the body to open, the arms to relax.